In September 2015, every country of the world signed on to a Declaration of Sustainable Development Goals. SDG 3 calls on us to enact universal health coverage to ensure healthy lives and promote well-being for all. SDG 3.8 mandates access to quality essential health services without incurring financial risk. SDG 3C calls for increase in trained health workers. Professionalized community health workers are a low-cost intervention that have a significant impact on maternal child survival and health.
We need to reduce the enormous disparities which exist in the health status of people around the world. That's a basic human right and one of our basic obligations as a global society.
Universal health coverage is important now because we have got the capability to do it. And globally speaking, we have got the financial means to do it.
Universal health coverage ensures that all people living everywhere, irrespective of their social, financial status, have access to quality health care.
We know that universal health coverage is feasible. We know the technologies that can save millions and millions of lives and are already doing so. We know that the revolution of information and communications technologies are changing health delivery all over the world, but with huge benefits in the poorest countries.
Community health workers help bridge the gap by the fact that they live and work in the communities where they are known and well established. And there is no distance because in health facilities, especially in Africa, are very far from communities, and they break this distance by being present in the community.
Their ability to identify danger signs, coupled with the use of mobile technology and mobile phones to facilitate referrals, leads to saving lives.
Given the great difficulty in building more facilities and staffing them, we don't have any choice, for the near term at least, other than to build an effective community health worker program. This is the most effective and the quickest way of achieving universal health coverage.
Data is important because without data, we cannot monitor our progress to know the corrective measures we need to take in order to achieve universal health coverage.
This so that we can design interventions to ensure that everybody receives the basic services that are essential.
We have effective interventions and smart systems based on innovative technologies such as mobile telephony. mHealth is particularly useful in low-income setting where CHW's use of smartphone application provides real-time data for management, for adaptive implementation, and for surveillance of emerging diseases. Data-driven supplementation is a critical component of UHC and should be a high priority for any smart health system.
Vast parts of Africa are sparsely populated and many people live far away from fixed facilities as they now exist, and even with the deployment of community health workers, there still will be issues of geographic access.
There is the social cultural barrier because the training of most health workers is foreign to African cultures, and therefore people don't utilize it. But with community health workers, they live with the people, they have the nuances and the social cultural closeness to work effectively and successfully in communities.
The human error associated with paper-based data collection is equally a contributing factor to the difficulty in identifying the health needs.
We have 15 years to achieve universal health coverage. We have tremendous momentum, and we have a wealth of know-how and technologies. Let's get on to it. Let's celebrate Universal Health Coverage Day.
for all.
Health 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 for all.
La santé pour tous.
Health for all.